to introduce the acting registrar, Lise Bettridge. I will ask her to deliver her report. But before I do that, I will deviate from my script for a moment to say that my fellow councillors and I are so grateful to you, Lise. This has been a sad and difficult year for you. We want to take this opportunity to publicly acknowledge and thank you for stepping up to the plate and carrying on with the management of the operation of the college. We also want to say thank you to the staff. They are such consummate professionals. But there's no denying that everyone at OCSWSSW for these past few months have had a very, very hard time indeed. So thank you all. And now the acting register report, please.
I always have to raise the microphone. Thank you very much, Beatrice, and thank you for those kind words especially. And I join Beatrice in welcoming you to this year's annual meeting and Education Day. On behalf of the College Council, staff, and members, I would like to thank Minister Jacek for attending today's annual meeting and tribute to Glenda MacDonald. We are honored that she was able to be with us today and thank her for her kind words. As you can imagine, our plans for this year's AMED shifted sadly and abruptly with the passing of our Registrar and CEO, Glenda MacDonald, on May 25th. I've had the privilege of working with Glenda over the past 5.5 years, first as Director of Professional Practice, and then, as of January 2014, as Deputy Registrar. Although, like many of you, I'd been aware of Glenda's distinguished reputation as a strong, decisive, and visionary leader, it was incredibly enriching, at times entertaining, and always rewarding to be able to work alongside her once I joined the staff at the college. Glenda played a hugely significant role for me as a mentor and a teacher. She was also extremely supportive and kind to me on a personal level. It would not be an overstatement to suggest that Glenda was a pioneer in social work and social service work regulation, and someone who influenced regulation at a national and international level. She's set the stage for further growth and influence of the college in significant and lasting ways. I feel so privileged to have worked with and learned from Glenda, and I will miss her deeply. I think the words of Charlie Morrison from the Ontario College of Teachers say it so well. I know you and others have been privileged to work with her and learn from her leadership. She touched not only those who worked directly with her. She reached out to me on many occasions. Her knowledge and commitment to professional regulation was second to none, but it was her gentle manner, kindness, and embracing wit that I will remember most. The theme for this year's annual meeting and Education Day is building capacity across the spectrum. Some of you may have interpreted this theme very specifically, connecting it with capacity and consent. And this interpretation is reflected in our keynote address from Laura Tamblin-Watts later this morning. We're very much looking forward to this. Capacity can refer to the ability to understand, to make decisions, and to consent. Capacity is something that we can lose, and it is something that we can build. We can do this at an individual level, but also as a group or a community. Assessing and building capacity are essential aspects of the work that social workers and social service workers do every day. Our members enhance or build their clients' capacity and support their strengths across the spectrum in all that they do, whether with children, youth, the elderly, those living with poverty, facing other barriers. Obviously, this is not an exhaustive list. The spectrum of social work and social service work also includes clinical and non-clinical, direct and indirect practice. One commonality within social work and social service work practice is a focus on building on strengths, on capacity, and on diversity. This year's theme will be reflected in the range of topics addressed today, from the keynote to the afternoon breakouts. As Beatrice has mentioned, 2015 is an important milestone for the college as it marks our 15th year in operation. Looking back on these 15 years, it's appropriate to feel a great sense of accomplishment and pride. Much has been accomplished, and yet there are many opportunities ahead. I can't emphasize enough that none of the accomplishments of the past 15 years would have been possible without Glenda's hard work, dedication, and unwavering vision. As acting registrar of the college, it's my task this morning to provide a snapshot of the operational activities of the college in 2014. The operations of the college are guided by our legislation, as well as policy direction approved by council. The accomplishments that I will report on today are the result of the hard work of all the staff of the college, guided by a very capable management team. I want to begin by commenting on the college's finances as reported in the annual report and by our auditor, Talia Rubin, who will be speaking after me. As you can see, the college continues to be in a very healthy financial position. As reported previously, the council made a strategic decision in 2009 to approve deficit budgets in order to draw down on the reserve fund in a planned and gradual way. The intent of this decision was to ensure that the accumulated surplus represented by the reserve was reasonable and sufficient to meet the long-term viability of the college and not excessive for the intended purposes. Through its annual budget process, the college continues to refine its forecasting and budgeting processes to ensure that it will have adequate funding to address its ongoing obligations to implement existing programs and new programs in order to fulfill its mandate. All our decisions are made in the service of our mandate of governing the professions of social work and social service work and serving and protecting the public interest. I would like now to highlight 3 expense categories contained in the summary of the audited financial statements as set out in the annual report, in order to provide some further details with respect to the budget lines, which have shown a significant increase when compared with 2013. The first category I will comment on is premises rent. In 2014, you'll note that there's been an increase of approximately $240,000 when compared with 2013. This increase reflects the expansion of the college office space in 2014. And when budgeting for 2014, Council approved the expansion of the college premises in order to ensure that the organization was able to respond to increased membership and additional staff to serve that membership over the next 10 years. You'll also note that there was an increase in the office supplies category. This also relates to the office expansion and reflects costs associated with furnishing and purchasing supplies and equipment for the new premises. As you've also seen, the consulting line increased by about $63,000 when compared to 2013. This increase is due to the evaluation of the Continuing Competence Program, which I'll speak about more shortly, and database support and improvements. Finally, expenses in the website line increased by approximately $32,000 in 2014, reflecting preparations for the launch of the college's new mobile-friendly and AODA-compliant website in the spring of 2014. The improvements to the website were critical to ensure that the college remained current, met its legislative obligations, and supported its members and other stakeholders by updating this extremely important resource. I hope that this brief explanation provides some assurance that the council and staff take very seriously our fiduciary responsibility to be responsible stewards of the college finances while ensuring that the college has the resources available to fulfill its mandate, meet its statutory obligations, and provide important services to you, our members. I referred to the increase in membership in the college, and as you will note from the annual report, 1,898 new members were registered in 2014, which is an 8% increase over the number of new members registered in 2013. Once again, we were pleased with the number of new graduate members. Overall, 969 new graduates were registered in 2014. 95% of members renewed their membership with the college in 2014, bringing the total number of members in the college as of December 31st, 2014 to 17,430. This represents a 9% increase in membership over 2013. In 2014, as it does each year, The college, and specifically the registration department, submitted its annual reports on its registration practices to the Office of the Fairness Commissioner in accordance with the Fair Access to the Regulated Professions Act. In this area and others, the college is committed to continually improving its processes and ensuring transparency and fairness. In the area of professional practice, an important focus in 2014 continued to be providing support to members participating in the Continuing Competence Program. The support provided by the department, as well as members' commitment to their own ongoing professional development and to the CCP, was reflected in the 99% compliance rate last year. The Professional Practice Department also provided over 2,400 practice consultations to members in 2014. Practice consultations are an important and proactive way that the college ensures that its members are practicing in accordance with the Code of Ethics and Standards of Practice. The college also stayed connected with members and other stakeholders via 2 issues of Perspective and through the distribution of several e-bulletins, as well as the regional educational forums last year in Timmins and London. As I've mentioned, the college conducted an evaluation of the CCP in 2014, something I'm sure most of you are aware of. The evaluation was concluded in December 2014. The results of the evaluation have gone to Council for its consideration and next steps. We were very pleased with the high response rate, which indicated that the importance that members place on this important program. We expect that there will be changes and improvements to the program based on the outcome of the evaluation, and we will be communicating with our members about those changes in the coming months. Thank you to all who participated. We've been aware for a while that many members approach the CCP in different and creative ways, and a goal for 2015 and 16 is to highlight some of these innovative and unique approaches so that other members can learn from them as well. If you're a member who's taken such an approach, we invite you to share your experience with others by participating in a short interview which could be published on the college website. If you're intrigued by this possibility, please leave your business card or contact information with a staff person at the registration table, and we will get back to you. Of course, I can't miss this important opportunity to provide a brief update about psychotherapy. As members will know from previous college communications, the Ontario government proclaimed into force most of the balance of the provisions of the Psychotherapy Act on April 1st, 2015. The government has not proclaimed into force the provisions in the Regulated Health Professions Act setting out the controlled active psychotherapy and authorizing members of OCSWSSW to perform it, or the provision in the Social Work and Social Service Work Act permitting members who are authorized to perform the controlled active psychotherapy to use the title psychotherapist. This development affects members of the college who practice psychotherapy and/or use the title psychotherapist, as well as those who wish to do so in the future. The provision of psychotherapy services remains in the public domain, and members of the college may continue to provide psychotherapy services, provided they are competent to do so. However, effective April 1st, 2015, only members of the newly created College of Registered Psychotherapists and Registered Mental Health Therapists of Ontario, or CRPO, are permitted to use the title psychotherapist, registered psychotherapist, or registered mental health therapist. The college has been responding on an ongoing basis to members' concerns and questions about this issue. We continue to be in communication with our ministry, as well as the Ministry of Health and Long-Term Care. We've also been working collaboratively with the Ontario Association of Social Workers, as each of us address this issue from the perspective of our respective mandates. We will also continue to work with the other colleges whose members will have access to the Controlled Act once it's proclaimed, and we're committed to keeping you, our members, informed as the issue evolves. In terms of the college's complaints and discipline processes, in 2014, the college received 76 new complaints regarding conduct of members of the college and 36 new mandatory reports. The Complaints Committee issued 24 decisions. The Discipline Committee completed 1 pre-hearing conference, conducted 4 hearings, and issued 4 decisions. The annual report contains further information regarding the issues raised by these complaints and statistics regarding the disposition of these matters. As you know, summaries of the decisions of the Discipline Committee are published in the Perspective newsletter and on the college website. So as you can see, 2014 was another productive year at the college, but one which posed some difficult challenges. I wish to take this opportunity to thank Beatrice and members of council and committees for their ongoing support. The positive working relationship that exists between staff and members of council and committees is something which will continue. And last, but by no means least, I wish to acknowledge and thank the dedicated staff of the college. Together, we continue to be committed to excellence and effectiveness in our duty to protect the public interest and govern our members. And finally, before we proceed with our day, I'd like to remind you that the college is now officially on Twitter. So join us and the discussion about today's events by using the hashtag AMED 2015. I'm sure you can't imagine how we came up with that. Thank you.